Tonsil stones. They can actually smell pretty bad. I've actually had a number of people over the years come into the office with tonsil stones, or like the medical word is tonsilloliths. They look like this. They're little stones sort of packed within the folds of the tonsils. And yeah, they can smell. And interestingly enough, when patients have come into the office for me with these, they've often asked me to remove them. And yeah, I remove them. I get like a little, speculum or like a little something, okay? And I get that little guy out of there. So I'm going to teach you or tell you how you can remove tonsil stones at home, but I'm also going to first tell you what these things are, why they happen, what's going on, ways to prevent them, and yes, of course, how to remove them. Guys, I'm Dr. Jen Caudle. It is good to see you. All right, let's first start by what they are. Look at this. By the way, way in below, if you get tonsil stones or ever have, they are like these yellowish, whitish, like irregularly shaped things. They can be firm or soft. Again, they can smell. What are they? Well, really, it's like this whole conglomeration of like things like bacteria, saliva, food, and other debris that can collect and sort of generate this stone-like substance that collects within the folds of your tonsils. Okay. Now they can range. They can be small, like super small to the point where you can't even see you have them, or they can be super large actually. They can be soft and smushy, or they can be more firm and hard. Okay, they can kind of get hardened. Sometimes they last for weeks, sometimes they last for months or longer, and some people never get them. Like I've actually never had one to my knowledge, but some of my patients get them quite frequently. Some of them get them every now and then, very sparingly, okay? Now, let's talk about why they happen. First of all, if you get tonsil stones, it doesn't necessarily mean that you are not brushing your teeth and cleaning your mouth the way you should be, okay? Now, okay, we know that poor hygiene can contribute to tonsil stones, so you may be more likely to have tonsil stones if you're not flossing and brushing and stuff like that. But even those of you who are like the bomb.com at flossing and brushing and all that stuff can still get tonsil stones, all right? Some risk factors for developing tonsil stones. We talked about poor hygiene is a risk factor, but it's not a slam dunk. Smokers, it's another reason in the millions of reasons why you shouldn't smoke, okay? Because that can predispose you to tonsil stones. And by the way, guys, don't go anywhere. I'm going to tell you how to remove them at home, but you got to hear this stuff because it's super important. All right, if you drink lots of sugary drinks or eat lots of sugary food, that could actually predispose you to tonsil stones. It's another reason to eat healthy and eat a healthy, balanced diet. Poor hygiene, we talked about that. Family history. A tonsil, like tonsils with indentations, this is really important, right? You see these tonsils here, like there's a lot of like crypts and spaces and places for stones or things to develop. Yeah, that could predispose you to getting these, all right? But the thing is, it's really important to take care of them because not only do the stones themselves sometimes smell, they can cause bad breath. In fact, tonsil stones is a very sort of common or, expected cause of bad breath. So you don't really want them, all right? Also, it can cause a cough. Some people just feel like they have something in their throat. Their throat feels uncomfortable. They feel like there's something in their throat, discomfort with swallowing. Also, throat infections. Yeah, sore throats and throat infections can really happen because of these tonsil stones. Sometimes people can get ear pain, and if I didn't mention a cough, that is something people can get as well. All right, so the next part of the video is perhaps why you were here. It is the how to remove them. First, let me give you some prevention because the prevention is going to weigh into how to remove them. Prevention, good oral hygiene. We talked about that. Not a slam dunk, but so important, and poor hygiene is a risk factor. Brush and floss, etc. Cut back on your sugar intake, okay? Don't be eating lots of sugar all the time. We don't want you to do that anyway, all right? Don't smoke, okay? And make sure, or rather consider gargling with salt water after you eat, okay? Now, this weighs into and leads us into how to get rid of these at home. Many people, when you have these tonsil stones, many people are actually able to get like a cotton swab. People always ask me, well, if I'm not supposed to clean earwax out of my ear with cotton swabs, and by the way, you're not. Maybe I'll link a video here on not using cotton swabs for your ears. People are like, what am I supposed to use them for? Well, this is actually a good use. Use a cotton swab, okay? Get in there, and what you can do is sometimes push on the back of the tonsil, okay? And sometimes it'll just pop right out. My experience with them with my patients is like I get an object, something like that, either like a small little speculum or something I have in the office, like a swab, cotton swab, and I push in the back of the tonsil and it sort of pops right out, and I can just get it out and show them, and they're like, oh my God, that's what it is, right? So you can get a cotton swab and do that, okay? You can use other objects to get rid of it. I think it's really important to try not to use something sharp. You don't want to damage your tonsil or put you at risk for an infection. We don't need that on top of tonsil stones, right? Right. The other thing, gargling with salt water. I mentioned that in the prevention tips, so it very well may help prevent the tonsil stones, gargling with salt water after eating and things like that, but that can also be something that helps that tonsillar stone sort of come out, okay? So that may be something you give a try at home if the other methods have not worked. The other thing is your doctor can remove them, right? So if you are grossed out by it or just don't know how to do it or it's not coming out, see your family doctor. But the other thing is, especially if there's something unusual or like it's super big or whatever, an ear, nose, and throat doctor is your best bet because they do ears, noses, and throats. This is one of the things they do. And interestingly enough, like for definitive treatment, I suppose if there was a case that was bad enough, if someone kept getting like recurrent throat infections or just had other complications, an ENT doctor may potentially recommend like a tonsillectomy. Of course, that is like in stage, way down the line. And most people do not get tonsillectomies or have their tonsils removed because of tonsil stones. Yes, they can have complications though, so keep that in mind. I'm really curious, do you guys have tonsil stones? Please weigh in below. And I would also say too, I have a video on bad breath and like the causes of bad breath, so I will make sure I link that here. If you suffer with bad breath, this is one of the things I want you to be thinking about and talking to your doctor about, taking a look in your mouth and say, hey, is there something going on there that could be contributing to my bad breath, such as tonsil stones? Because, guys, it really can happen. But yeah, and interestingly enough, when I've removed these in the office, it has been oddly satisfying. I mean, I've removed things from people over the years a lot. Tonsil stones tend to be oddly satisfying, I have to say. But it is nice when people feel relieved because, again, tonsil stones can cause pain, discomfort, feeling uncomfortable, and all that good and bad stuff. The other things, of course, to keep in mind is make sure that you are brushing and flossing, that you are seeing your dentist regularly, okay? That you are seeing your family doctor, because as we do our head and neck exam, like what's another reason to come to the doctor even when you are well and not sick? Because we will look in your mouth, we will look in your nose, and we will look for things that you may not have seen. This is also important. Guys, I'm Dr. Jen. Let me know what you think about this video. Share this video with other people who may need to see it. Let me know how you remove tonsil stones if you do. Subscribe to my channel. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, and like literally every other platform in the entire world. I also have a free weekly newsletter, so I would really, 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 really love it if you signed up for that. Please go to my website. My website is drjencaudle.com. That's DRJENCAUDLE.com. Guys, I love y'all.